So thank you. I am Dr. Don Tyus. I'm the principal investigator of the Center of Excellence, as well as the director and the principal investigator of the Southeast Addiction Technology Transfer Center. Both are at Morehouse School of Medicine. It is truly a pleasure to be with you all today. You heard Ms. Gloria and I just talking, and one of the things that I really want out of this session is I really want to just provide you with some information. The information that I will be providing to you will be information about our center. But also a part of any time we have these opportunities, just because the center is here, is housed here at Morehouse School of Medicine, we're aware that a lot of that you all are boots on the ground. And so whenever I have a platform, I like to pose questions and just have a candid discussion, but also just to listen, because a lot of the things that we learn in conversations such as these help steer and guide our work. Yes, we have some things that we proposed in the grant, but there are also some real life scenarios, some real life strategies and tips that individuals need to work with this such distinct population. So the first thing I'll do is just go through my presentation, and then I'll pause so that I can really just have a conversation with you all and give you the opportunity to really answer some of our questions, or while you have my ear, to make some suggestions of some things that you would like to see or that you need out of a center such as this. So again, I'm excited to be here. I'm going to start sharing my screen, and then I'll put this on presentation mode. So this is the African American Behavioral Health Center of Excellence. Again, I am Dr. Don Tyus. I am the principal investigator, and I am the acting director right now because we're in the process of looking for a director. The center is comprised of our staff. We have Mr. Corey Ware. He's our training and TA coordinator, as well as we have another position that is available because we're looking to hire an additional training and TA coordinator. We have an evaluator as well as a lead writer and a marketing graphic designer who is also on our team. Who are we? Who are we? You've possibly heard about the African American Behavioral Health Center of Excellence, but let me just give you a really the short version of who we are. We're newly funded. We were funded beginning October 1 of 2020 for 5 years. This is a 5-year grant, and we were funded by the Substance Abuse and Mental Health Service Administration. And then what we were basically funded to do is to develop and disseminate training, technical assistance, and resources to help healthcare practitioners. That means behavioral health practitioners, that means doctors, that means nurses, psychologists, school teachers, university professors, help them eliminate behavioral health disparities within this large and diverse population. So I said a lot. Yes, we know that the African American population, that's a very diverse population, but we're also looking at, when we think about the structure and the diversity of this population, we're looking at the entities, the groups that are within that as well. We're looking at female, male, adolescent, children. We're looking at LGBTQ plus I. We're looking at older adults. So it is a very, very complex process that we'll be going through. And we know that this is a great challenge, but because of each of you and opportunities like this to tell people about the center, to engage people, we know that that will help inform the work that we do so that we can be very effective and impactful in providing services, in providing technical assistance, creating products, and just disseminating trainings as well to individual providers. We talked a little bit about, I talked a little bit about why were we funded. The federal government, we started this process with Southwest Advisory Board, where one of my colleagues, Ms. Maureen Nichols, is the director, but she has a very robust board, which is also inclusive of Ms. Gloria Jackson. So on their side, as well as Morehouse School of Medicine, we started to see that there was a greater need of working and providing services and providing and creating resources for individuals that are working with African Americans to look at those social determinants of health and look at that there needs to be greater equity and effectiveness in behavioral health services. So a process, I joined forces with Southwest's advisory board, who they had some contacts, and we really went to Congress. We had someone on our behalf to go to Congress and say, hey, there's a center for Hispanics, there's a center for Native Americans, and we would like for there to be a center for African Americans. We would like to think that our petitioning Congress, petitioning, going before them, requesting that this center come into play, played a major role in this center coming to petition or funding opportunity being set forth. And Morehouse School of Medicine, once they put the funding opportunity out there, Morehouse School of Medicine was the recipient of this center. So that's how we were funded. And then we were funded because at that time, the government, the SAMHSA started to look at that there is an urgent need because of the times that we're in, but also because of the lack of access, because of the stigma around behavioral health, because of those implicit and I'm sorry, I'm still trying to let people in. So many people are joining us because of um, there was a greater need for equity amongst for African Americans with these behavioral health services. And so we looked at this, the FOA, and our center, we knew that our center had to be structured and mobilized to speak and to have about the expertise and the scholarship for greater African Americans who's been at this for a long time. We're the voices with this center for those distinguished individuals who have plowed through this for quite some time. And we knew that some of our charge was to truly look at those systemic inequities that have blocked access and engagement in behavioral health services and support for African Americans. Looking at those systems that are unfair and unjust for African Americans, looking at those policies that are rooted but are not favorable when you're looking at behavioral health for African Americans, looking at the lack of support, looking at the biases, those unconscious biases, and helping people to really look at what are their implicit biases when working with this particular culture. And it's our job to really look at how can we assist systems in changing and so that they're providing quality and whole care for African Americans, Blacks and African Americans. If you hear me pause, it's because I'm having to let people in and then I look up and I see someone in. So I do apologize for that. But also, as we were researching and as we were preparing to write the grant, we noticed and it was unveiled that there's a scarcity of culturally appropriate evidence-based interventions and approaches for African Americans. And the ones that are out there, which are limited, they were not even being disseminated to providers. There were a lot of things that we were found that were outdated, more so than outdated. They were not culturally appropriate to deal. They didn't look at a lot of the trauma, the generational trauma that a lot of African Americans ensued. They didn't look at what are some of those social determinants of health that are impeding them to have holistic care. So we knew that it was our job as a part of the center to make sure that we're not only highlighting the health and care of African Americans, but we're providing and we're creating and teaching people some of those strategies, being able to have those resources as guiding principles and guiding practices for practitioners. Then also we discovered that we all, if you're in several different fields, but we know in the behavioral health field that there is minimal workforce development, looking at the social determinants of health, looking at health disparities, looking at again that historical trauma, looking at those unconscious bias, but also there were little or lack of resources as well as how do you build cross-cultural respect and trust? If you're a clinician and you have a client, how do you build that level of trust where you're comfortable, where you're not counter transferring your thoughts and feelings onto your client, or you're assuming or thinking the level of what they've gone through, but you really have some sure-found strategies to help them navigate through that process. But those strategies have to be rooted in culturally appropriateness. So what it is that the center will do, how will we do all of this? What are our thoughts? What is it that we're trying to accomplish? So I just talked about what we were funded to do, but as we created and we continue to develop this center, we've already know that we will be taking a highly collaborative public health approach to a cultural and practical transformation of variations of systems. It is important that this is just like a public health cry. And it's important that we can't just create and provide strategies and practices for treatment and recovery. But we have to look at the systems. We have to look at the governmental system, Department of Transportation, the food system, agriculture. We have to look at all those systems because they play into a part of why there are disparities when it comes to African Americans. So our job and what we are on a mission to do is really look at the transformation of behavioral health systems, looking at the professional and the non-professional workforce, as well as, again, providing those interventions, treatment, recovery support practices for clinicians. And then even looking at the systems of education and how people are being trained. What resources are they using? So we'll be providing variations of trainings via webinar, and hopefully soon we'll be able to start that doing live webinars and training, but also providing technical assistance to the field. And by way of technical assistance, being able to have conversations, being able to, if you're struggling and you're in need of a training on a particular subject, or if you're in need of a resource, being able to have a repository that we can point you to adequate resources that will provide holistic care for the African American clients and the communities in which we thrive. How will we do this? Again, we've talked about who we are, what it is that we're hoping to do, but we have to think about how we're going to be able to do this. Here at Morehouse School of Medicine, this center was so aligned with what our mission and vision is here at the university, where we look at underserved population, where we work with underserved populations, Black and African American communities. That's just our charge. That's what we do. So building on the expertise of Morehouse School of Medicine and our large, diverse community of Black stakeholders here, scientists, educators, the Center of Excellence for Behavioral Health Disparities, we're going to use innovative, evidence-based, culturally aligned systems change, workforce development. We'll be doing technology transfer, and we'll be collaborating with some national partners, some boots on the ground community partners to help us eliminate disparities in order to promote behavioral health and health equity for African Americans. So I've said a mouthful, right? So this is the moment where I need to just take a breath because I said a lot. And as I thought about that, and each time I say that, it just reminds me that this is not something that we can do alone. It takes everyone in the room, it takes people that you're having conversations with to help us with this mission. We know that it's a large charge to try to eliminate disparities, but I often tell my staff is that we're in year one, but I'm already at year four. And the reason I'm at year four is because between the years of 1 and 3, we need to have done the most impactful and effective and sustainable work that we can to make some real big footprints in the sand and eliminating these disparities. We have a very serious charge on us. And if we know that we can't become so big-headed and thinking that we're in this alone and work in silo, because if we're working in silo, then we're not working at all, because it takes a group of individuals, it takes the communities, it takes other races. Yes, we're focusing on African Americans, but it also takes a lot of my colleagues to help us work through this, because we all have had experience in some shape or form. We're all experts in our own way, and we need to have the listening ear. These conversations, we need to keep them going. And a few of our 4 goals are: 1, we want to increase the capacity of behavioral health systems to provide outreach, engage, retain, and effectively care for Black African Americans. That's what our goal. We want to help the behavioral health systems to do this and do this properly and with care and with humility and with grace, with professionalism, but all while rooted in evidence-based practices. We want to make sure that we improve the dissemination of up-to-date information that is culturally appropriate, evidence-based. We want to be able to make sure that the approaches that clinicians, doctors are utilizing with this population, that they are best practices and that they are, again, culturally appropriate. And you'll hear me continue to say that because there are a lot of best practices out there, but the best practices, they have to be relevant to the population that you're serving. And in this case, for Blacks and African American people. Goal 3 is also making sure that we increase workforce development opportunities that are focused on removing those implicit biases, looking at those social determinants of health that are talking about structural racism and other factors that impede high quality care for Black African American people, meaning that I want looking at your system to make sure that you're hiring qualified African American people, making sure that when you're looking at your leadership roles, and it goes beyond putting a diversity, equity, and inclusion officer on your board, but really looking at your system, really looking at your organization, really looking at the structure to make sure that you're not impeding that high quality care, that you are paying attention and looking at if you're providing care for people in rural communities, that they have access to some level of technology, that you're not on the north side and all of your clients are on the south side, but there are no bus systems. So maybe you can set up a pilot center or a pilot hospital, but just looking individually internally at your own system and taking a real look at what are those changes that I need to be able to make within this organization where you have influence to make sure that we're creating and we're providing holistic care and making sure that the people who we're serving, African Americans, they have access to these systems. And then also to increase collaboration between our center, all of SAMHSA's TTA providers, the communities, the faith communities, looking at the barbershops, looking at where our people thrive, and even working with boots on the ground and the individuals who we are serving, providing them with knowledge about their own healthcare, providing them with questions, the right questions to ask their healthcare providers, and understanding that it's okay to seek treatment, but also in the process of seeking to know what they're seeking, but also to be able to have the right questions to ask. So we want to make sure that we're not again being in silo, but working with and engaging collaborative partners throughout this. And this goes beyond just SAMHSA TTA providers, but SAMHSA, the government has funded a lot of these centers. There's a Center of Excellence for Aging, Center of Excellence for LGBTQ plus. I have to say that real fast so that I won't leave out a letter. But there are centers for Hispanics. Then there are also mental health and substance use centers like the Addiction Technology Transfer Centers, the Mental Health Technology Transfer Centers, as well as the Prevention Technology Transfer Centers. But we want to make sure that we're engaging all of these providers because looking from a mental health perspective, looking at substance use, all of those are issues that African Americans are often faced with. And collectively, we need to be saying the same thing, speaking the same language, and making sure that the end goal is to provide sustainable, effective care. This is the way that our structure is set up. That I'm so proud of it because this is such a large task. One of the things that we thought about as we were writing this grant is that we would have to have some teams of individuals. We are so blessed and so thankful to have some of the best lead subject matter experts to be working with us on this particular grant who offered to take lead. They've committed to take lead on this. And so we have a primary coordination and evaluation team. That team is being led by Dr. Janice Pringle, who has many years of evaluation services. She's out of the University of Pittsburgh, and her evaluation assistant, Miss Lois Edmondson, worked very closely with her, and they make sure that not only are we don't want to just do bean counting. We want to look at the impact and the impact of all of our services, all of our products, because if it's not impactful, then it's not right. It's not the expectation of mine as the principal investigator. We know that we can create because there are a lot of resources out there. There are a lot of evidence-based practices and approaches. But for us and for me in leading the center, if it does not have an impact, we need to go back to the drawing board because impact, we want it to be sustainable. We just don't want to look at the 5 years and be able to say, we did this, we checked that box. Yes, everybody's feeling good. I want to be able to look back and say, we had some real solid, profound change and that change is sustainable, but also it geared people up to continue to make footprints in the sand. We also have a very robust executive advisory board who is a part of this. And in creating the advisory board, one of my thought processes was we needed some pioneers. I wanted the people at the table who were smarter than me, who had more experience, more knowledge than I have. I wanted those people who have been at this for years to help guide us, to help steer us, to help us put those footprints in the sand. But the other part is outside of the advisory group, we have what we created. It's called a Black Stakeholder Engagement Council. And this is where everyone in this room and your friends and your grandmamas and your grandfathers and your children play a part. This is where the neighborhood barbershops, sororities, fraternities, the gym, the people, your churches, the people who are boots on the ground. As an African American, I know, several of you know that a lot of us, we rely heavily on our faith community before we'll go to traditional therapy because of the stigma behind a lot of mental health needs. We talk to our barbershops. Anytime I'm getting my hair fixed, I'm talking to my stylist about a lot of things that are going on in my life. So one of the things that I thought about, it is our charge, it is our duty to make sure that we're equipping boots on the ground with conversation tips and strategies, with knowledge and information around mental health, around substance use disorders, around looking at structural racism, making it as layman as we can so we can have engaging conversations so that people in our communities can feel that we are empowered, that we are equipped, that we have solution focused different strategies, that we have strength based approaches to helping and getting the care that we need. But also, I spoke briefly about previously about some of the national strategic groups. But a part of this is not only having the pioneers, our lead executive advisory board, having boots on the ground, but it's important that we also collaborate with some national strategic partner groups, with individuals on a national level who are already doing this and who we won't have to reinvent the wheel, but we can add to the wheel. So we have a very robust group that is continually growing that we're collaborating with. We have 4 core teams. Our behavioral health system transformation will be looking from a systems level transformation perspective, and helping change systems is being led by Dr. Ijama Achara. To look at when I spoke about those culturally appropriate evidence-based practices, that is being led by our subject matter expert, Dr. Nzinga Harrison. She's double board certified. She's a psychiatrist. She's an addictionologist. And then I'm sorry, I didn't say Dr. Ijama Char. She's led she's worked with Dr. Arthur Evans, Dr. Bill White. She's led several systems transformation, and she's known for recovery oriented systems of care model. So she's amazing. Our culturally competent workforce lead would be Dr. Deetra Hawkins. She's led a work tirelessly in this field to making sure that there's diversification in culturally competent workforce, and we're hiring African Americans, that we're utilizing the appropriate methods and strategies in doing so. And then to help us make sure that we're collaborating with all of SAMHSA's TA centers, that's Dr. Holly Hagel. She is the director of the National Addiction Technology Transfer, as well as co-PI and co-director of the Prevention Technology Transfer Center. I'm very proud of our advisory board. It's led up and comprised of some amazing physicians, addictionologists, social workers, peer recovery individuals. Is so robust, but these are the main executive board because we have people with real life experiences, peers. We have clergy that are on our advisory board, but our executive committee is Dr. Ajama Char, Dr. Cannon, Dr. Wesley Clark, Dr. Arthur Evans, Dr. Nzinga Harrison, Dr. Deetra Hawkins, Dr. Keisha Holden. You may be familiar with Dr. Rochelle Head Dunham, Dr. Kamar Jones, Dr. Dominic Mack, who is my boss here at the university, Mark Sanders, and Dr. Sarah Benson. So we have a plethora of experience and expertise that sit on this board. So we're in really, really good hands. I'm proud, and I'm hoping that by the time I finish that you're proud of what we're creating here. And this is just a little, as you're thinking about your organization, and if you're interested in being a part of the Black Stakeholders Engagement Council, We'll have an executive committee of that as well, but we're just getting individuals who have influence and who don't have influence, but we all have some level of influence in the communities that we thrive in. And so if you're interested or your organization of being a part of the Black Stakeholders Engagement Council, the duties and expectations is that we'll be putting together an executive board, but the council, we want to bring people together 2 times per year. They'll help us, the primary goal, help us to disseminate and promote the activities and resources of the center, but also to attend trainings that we'll be able to provide trainings in your for your local barbershops, for your local community, event centers, and then also identify other areas of potential collaboration. And that also will provide a platform where we'll do a needs assessment for our engagement council to determine what some of their needs are as boots on the ground and what are things that they need that we need to be specifically creating. There are ears and our eyes in these communities. But also I believe in any time you're asking people for help that it needs to be bi-directional. So we'll also be putting forth seed money where we'll have a competitive process where individuals who are part of our stakeholder engagement council where they'll be able to receive mini grants to also to do activities that will help foster and create opportunities to really talk about behavioral health disparities and needs within the African American communities. So that will be beginning in year 2. We'll put those seed grants out there. And then just this is just the for if you're a national partner that you're interested in, or if you know some national partners, you can send them our way. That group meets 1 time a year, and they'll also do a lot of the same things that the Black Engagement Council will be doing, but also they'll be helping us with some of the systemic systems change work that we have indicated that we will be doing. But also the Black stakeholder engagement, it is really African American oriented engagement council. I'm sorry, I'm going backwards. Man, I'm excited. My team is definitely, they've been working hard since October to get our website up and running. We have a plethora of resources that are already out there. And these resources, you can help you to, in your field, help look at systems change. And it help a lot of the resources are taking a deep dive at how you can even alleviate behavioral health disparities. We have resources, and if this works, we're going to do it. Let's see if it'll take us there. I want to just see if it'll bring it up for me. I wanted to just show you a little bit. We have a few minutes. So this is our website here where you can submit a request. I wanted to make sure that I highlight this because when I think about a request, if you're in need of a resource, or if you're looking for a trainer, a training, or if you have a question, that is where you'll go to our website at africanamericanbehavioralhealth.org, and you'll be able to submit that request. And right now, Mr. Ware or my administrative assistant, Ms. Pamela Lee, they'll answer that request and they'll get in touch with you so they can really have a conversation with you to determine what that need is and to see how the center can be of assistance to you. Also, when you look at our resource page, there's a page that is just specifically our resources, and I'm then it's slow to load because these are resources that the center have already created. There are a lot of resources. We have some of our webinars that are out there that we're featuring and highlighting, and then we have some products. Last month, June, was Men's Health Month, and so Mr. Corey Ware and Ms. Celine Craig and Mrs. Pamela Wall, they created some amazing products and infographics that are looking at behavioral health for men as well as general health, just specifically for men. There's an article, an essay that we put out when we first started creating this back in October, September, what we believe. And it's just really fostering and moving forth the needle of what we believe that this African American Center of Excellence has been charged with doing. And it's our beliefs around language, it's talking about truth telling. So that's an amazing resource that you can download. Also, there's Ms. Pam Wall did Many Rivers to Cross. It's really looking at what we've seen during our research in trying to develop this center, some of the critical challenges and how they're aligned with our overarching goals. But also one thing that I think is very, very important, which lends to our previous speaker, the author, is talking about healing history. And this is an amazing self-study and discussion guide that is a downloadable resource that allows you to really look at history and really look at the effects of history on your own experience and the work that you're doing. So I would employ you to do that, as well as just a press announcement that's out there. But also, a part of our resource center is Corey has been really working hard, as well as Miss Pamela Wall, to make sure that we have a curated resource list library. And this list is just things that we come across that we think can assist you in the work that you're doing. And it's noteworthy to be on our site. So please just go and check out that. You'll see how to get in touch with myself as well as Corey. Now let's see if I can go back to the magic trick and go back to showing my slide. Good, good, good. I did good. So again, it's AfricanAmericanBehavioralHealth.org. So I want to kind of come here and I want to see you all. So I'm going to go back to stop sharing for right now. And I just want to talk to you about these questions. And you can either raise your hand or come off mute. And the questions that I want to really kind of pose, and just to have we have a few more minutes, is to really look at and ask you the question. The first question is, what barriers or challenges are you or your organization experiencing when working with African American clients? And just really just kind of a couple of people, if you don't mind coming off mute and just talking as you've been doing this work, because I want to make sure that we have our pulse, our hand on the pulse and our ear to the ground, and want to be mindful and respectful of some of the challenges that you're seeing as you are doing this work. I see in the chat, someone says lack of mental health resources in the community. That's Mr. John Allison. And I hope, Mr. Allison, that you saw as one of our goals is to really create some of those products for you. And there are a lot of things that we've already curated and created if you look on our website, but please submit a request, send me an email. I put Corey's email in the chat. He's CM, where Corey, I know that you're on. Will you please put your email address in the chat as well so that you can send us an email if there are things that you come across or in need of. Thank you for that. Someone else? Everybody shy? Okay, I didn't see anyone with their hands raised. So I'll go to the next question. The next question is, what would you say are three of the most, you don't have to give me three, but just three of the most challenging areas of healthcare disparities and inequities for African Americans in your particular area of focus? If you're a doctor, if you're a mental health counselor, if you're a substance use professional, if you are a faith leader in your area of focus, if you're an educator, what would you say are some of the most challenging areas of healthcare disparities and inequities for African Americans? Someone said financial planning and emergency strategies. That came from Ms. Jennifer Bridgewater. Thank you, Jennifer. I know you're out there. Okay. Someone said trust in the medical field. We have found that is, and that's what we, of course, with the COVID hesitancy, I think that is a very good example when we look at COVID and the number of African Americans who are very who are not trusting the system to become vaccinated. I think, and that goes back to historical trust that we have in the medical field. Also, again, insurance coverage, looking at the transportation, primary care providers, sometimes they don't have access to that, a lack of support system. All of these are excellent. And all of these lead back to those social determinants of health, looking at childcare. And I'll say this too, I posed to my project officer of SAMHSA, when you're looking at the social determinants of health, it comes from the banking system, the transportation system, the childcare system. And I've asked if he'll work with me, because it's important that we get the head of these organizations to have a conversation, to let's look at all of our thought process and to collectively come together, because that's the only way we're going to be able to alleviate these disparities, is truly by looking and working with all of these systems and having conversations and coming out of silo, and not necessarily reinventing the wheel, but all of us enhancing the wheel by coming together and taking a serious, real life approach to looking at what the issues are and how can we work together to be able to move the needle and move this forward and provide health care that is accessible, quality health care, but also affordable health care. And then access to education, and definitely have the Department of Education need to be at the table. And my a lot of you put already what some of your resources. My last question was around resources and tools that you need. I'll go back to my PowerPoint. Let me go back to sharing my screen. I'm sorry. Because you all can't see my screen. Get us back to where we were. I'm sorry about that. Those were the questions. And so one of my favorite quotes is, and I have a lot more of them now that I've immersed myself in doing this work. But one of the main ones that really charged me in keeping me outside of my head, and just to understand that I have to look inward in order to be able to do this work. But also, it reminds me that an individual, Martin Luther King Jr. indicated that an individual has not started living until he can rise above the narrow confines of his individualistic concerns to the broader concerns of all humanity. So I choose, although I look inward, to check my own biases and to look at my own concerns. But in order to be able to do this work and to be able to lead my staff and to be able to be impactful, I have to be able to look at the broader concerns of all humanity. And in this case, it's not just looking at what is best for African Americans, but working with individuals who may not think like I think, who may not act like I think, but being able to come together collectively and reminding myself that in my staff, that the broader concerns has to be for overall humanity. So I leave you with that charge. I leave you with and challenge you to take a look individually and internally so that you can check yourself each and every day to go out and to do the work that has a broader impact for all of humanity. And if you need to get in touch with me, this is my contact information. I am at the Morehouse School of Medicine in the National Center for Primary Care. But that's all that I have. And we have a few minutes, and if you would like to come off mute and anyone have any questions for me, Corey, if you'll help me please monitor the chat, then that would be helpful. But anyone, if you want to just come off mute, if you have any questions for me, I would be obliged those at this time. Thank you. Tracy, excuse me, Ms. Tracy Murray, you can please come off mute.
Hey, good morning, Dr. Tyus.
So
I'm Tracy Murray. I serve as the Assistant Regional Administrator for SAMHSA out of the Region 6 office based in Dallas. And so just thank you for your presentation today. One of the things that you mentioned as a goal for your Center of Excellence was really collaboration with other SAMHSA TA centers. And I just wanted to commend you for that goal and just also inquire about opportunities and working with, for example, like how SAMHSA has its Office of Behavioral Health Equity, which is like our version of an Office of Minority Health. Or we also have the HBCU Center of Excellence for Behavioral Health. And some of the regional offices may also be working on some of these topics. I know in my office in Region 6, really focusing on diversity in the workforce and starting the pipeline earlier in building interest in the behavioral health workforce. And so I just wanted to get some feedback from you on like progress in those areas, or just if there are any initiatives or projects coming up in ways of collaborating. And you mentioned Maureen Nichols, who's in my Southwest, and so she's certainly a colleague of mine. But this is such an important work, and especially in talking to like state commissioners here in Region 6, the workforce alone is such a major issue, not just recruitment, but also retaining the workforce, and how do we build a more diverse workforce, not just of more Black or African American, but just even thinking about other persons of color coming into the field. And if we look at the data to show that minority communities are the ones who are in most need of help or have these greater gaps in treatment. But I just strongly believe that data supports, if we have more people who look like us on the other side of the table, that would begin to help with the things that we saw in the chat, like building trust in the healthcare field, because I might feel like you can better relate to my experiences, right? Or that I can seek help because I might feel that you are more supportive and understanding of my experience as a person of color, as a woman of color. And so I just wanted to share those comments, but then also to get your feedback on those opportunities.
So thank you, and it's a pleasure to virtually meet you. What we're doing, and then for the South Southwest, they're also a part of this. They're a subcontract of this to actually look at the workforce development issue, to look at the diversity. And I know that they've already started with their plan because they're going to do a across the I know their region, but across with other providers, they're doing a survey. That's the first thing as far as the workforce piece. But to be able to work with SAMHSA, other TT centers, we've already identified. So you just let me say this too. So with startups, sometimes it's hard to get staff. So we're just really getting fully staffed. So our staff, we're working to identify all of those actual different partners, the Department of Suicide at SAMHSA, all of the different entities that we can bring to the table. Because I think one of what I do believe, and I've spoken with my project officer, Umberto, is that we really need to see what the other entities are doing on a federal level so that we won't just be reinventing a wheel, but we can all collectively work together. So my goal is the beginning by the fall of the year is to have a really big thought tank with a lot of those entities to be able to say, in region, because we are having to look at it. And I'm regional also because of the ATTC, and I'm having to shift my mind to more national. So being able to work with the major offices, like you're saying, of HBC, looking at diversity, but all of those federal entities, and to see what their strategic plan is, and to see how that aligns with what we're doing. Because again, although we are the center of excellence, I think working with the national Hispanic group, looking at other minority groups, what has worked for them? What are those best practices? Because I really believe if we all start speaking the same language, if we all start shifting our perspective and start writing in some of the same language in our policies, start looking at our strategic plans and making sure our goals are aligned, that's when real change starts to happen. And when we're doing it in silo, that means that these goals are working for what I see from my perspective in my area.
Right.
But this is a collective approach. So that's what we're hoping to do. We have 5 years, but I really believe we have to have conversation before we can really put together what that strategic plan looks like.
Absolutely. Thank you.
So
Thank you so much.
Thank you. And please, you can send me an email as well. And
I will.
And I will be very interested in seeing what you're doing in your region. And we work very closely too with our Michael. We work very with Michael King in our region as well. So he's been very, very helpful with all of this. Thank you.
Thank you.
Hey, Ms. Dawn, you got a question in the chat from Cedric Dunmore.
Okay.
He says, the Center of Excellence is doing so much. My wife and I are clinicians in Austin, Texas. How can we get more involved in providing education and training on mental health and substance use within the communities of color in Austin, Fluggerville, Round Rock, Hutto, and Manor?
So what we're going to develop, thank you for that question, Mr. Dunmore. We're going to develop a portal of trainers, and those trainers have to be vetted. We're working on the criteria, but I know also if you're in Texas, Maureen, if you wanted to do something around the SUG, because each ATTC is also working and provide trainings around diversity as well. So I think one of the first steps until we can get our portal of trainers up and running is to really plug into your local ATTC. But if you send myself or Corey an email, as we continue to develop that criteria, as we continue to look at the curricula that we'll be developing online, because we will be creating courses that are online, then we can make sure that we send that information out to you once that's all finished. One of the things that we are looking to do, I know we used to develop, it used to take us a long time to develop product and courses. What we are also seeing is that clinicians, I'm a clinician myself, clinicians are in need immediately of resources. Clinicians are wanting us, people are wanting you to tell them what to do right now. They don't, people, because of where we are, people aren't wanting to really do a lot of the research. So we're trying to put things out at a faster pace, but I just don't want to put anything out. I want to make sure that those things are, one, rooted in the science, but also those things are effective and impactful and things that the field really needs. So we will be reaching out. We will be seeking other providers to assist us in doing a lot of this education and dissemination of resources. So thank you for that. I see one here from Miss Sheena. I did not want to butcher your name. Corey just answered it. They said, will we have a newsletter or some type of electronic broadcast mailing list we can sign up for? So you can go to our website to sign up for the mailing list. And we have a webinar actually that's coming up today. And if you get on our mailing list, and then you'll get all of our announcement. And then of course, our newsletter, Corey will be launching that in August. So excuse me, if you're on the listserv, then you'll be able to have access to that as well. And all of our trainings are free. We're now working to get our CEUs and CMEs up and running. So hopefully by the fall, you know, you have to, a new center, you have to make sure that you fill out all of these applications to get the CEUs. So right now we're not providing CEUs, but I can assure you, you don't want to miss the webinars because we've had some amazing webinars and some amazing facilitators. And we're archiving those as well on our YouTube channel, as well as we do highlight a lot of them on our website. Any more questions? I know we're at the 11:46 hour, and they want to give you an opportunity to go back and network, as well as go back to the platform to look at the sponsors. If there are not any more, are there any more questions? Let me see if I see anybody's hand raised. I don't. I hope this was very valuable information for you. I hope that you're able to if you need anything, send us an email. Please submit a request if there are requests. I know Corey's probably saying, Ms. Dawn, they're going to flood me with requests, but that's what we want to do, because this center, we're super excited about the work that we're doing and the work that is to come. But we're here for you. So if you need TA, or if you just want to ask us a question, or if you're looking for a particular resource, please tap into us. Otherwise, it's been a pleasure, and you have my contact information. Please feel free to reach out. Oh, and John asked me for I'll put my information in the chat for you. Sorry about that, John. Corey also put the registration link if anyone is interested in, I know you'll probably still be in this conference, but any of your colleagues or anyone is interested in the webinar, he just posted the link. I just put my email address and our office phone number in the chat for you all. If nothing else, I'll stop the recording, and I hope that you all have an amazing remainder of your conference.